Oh, come on, give me a break. Not about the surgery, about the video, right?
Oh, yeah.
Okay. All right. Just for let's kind of describe what happened. So you had surgery how many days ago?
I had it on Tuesday.
Tuesday, and today's Friday.
3 days.
3 days ago. Okay. And then we discharged you. We did a gastric sleeve.
Right.
We found no hiatal hernia, right? We didn't repair anything.
Right.
We actually always check. We push. And then we discharge you the morning after. And then what happened?
I had some broth around lunchtime, midtime, and a little after, I started to feel nauseous.
Okay, so after the broth, you felt a little nauseous, you threw up, and then it just perpetuated the cycle.
Yes, it got worse and worse.
And that's when you called us up, we picked you up, or they brought you here,
Yes.
and we readmitted you. And now, we did a barium swallow, and we found out that there's probably some type of hernia. And we were explaining, well, when your stomach's huge and large and nobody's been filling in with your stomach, everything's fine. But if you throw up, and throwing up is a violent act, especially after weight loss surgery, especially after a sleeve, well, the stomach doesn't look big and bulky like it normally is. Now we've created a tube-like looking stomach, which looks much like the esophagus. It's just basically a pipe that just goes down and down and down. And with the understanding that the diaphragm is the wall that divides from upper to lower chest to abdomen, and there's a hole where that esophagus goes through. Well, it would seem that your sleeve kind of crept up, not too much, a couple of inches, enough to block it, and that's why you're spitting out foam. So this would be considered a post-operative complication. Is it from exactly the surgery? I would say somewhat yes, because we modified your anatomy. Is there some way to avoid it? Well, yes, with anti-vomiting medicine, but you have that. Complications happen with weight loss surgery. Fortunately for us, we really look at the really aggressive ones, and those we don't want, so we've never had leaks. Those are really aggressive. But these happen once in a while. Why do they happen? Well, it's a combination of things. Your anatomy's changed. You did throw up. You got nauseous, you threw up, and throwing up is a violent act. Medications will diminish it, but they won't completely make it completely disappear. And the tissue, well, even though the tissue is worked on, sometimes in your case, we didn't work around the hiatus. It works. I mean, the tissue can be, well, somewhat less than the ideal quality because it's infiltrated with fat. And that's going to happen down the road. So what we're going to do is we're going to go back in, pull the stomach back, anchor it with a number of sutures, and then close the hiatus in order for it to stay where it's supposed to stay. And well, we're going to see part 2, which is the surgical part, in a little bit, and put it online.
Oh, okay.
Any questions?
No, I don't.
All right, we good?
Thank you. Yes.
I'll fix you.
Yes.
All right, thanks.
Uh-huh.